Let's assume that before entering the client's room, verify the doctor's order. Then after verifying the doctor's order, gather the equipments needed while doing this procedure. And after that, perform hand hygiene for at least 10 to 15 seconds. Then after performing hand hygiene, identify the client using two identifiers. Edad niyo po?
20.
Birthday niyo po?
November 30, 2000.
Next is to explain the client the purpose of oxygen administration and the safety precautions. So para po makahangos po ko muning malinas, ma-administer po kita ng oxygen para madagdagan po yung oxygen na niyo po. Then attach delivery device to oxygen tubing. Considers extension tubing for clients who are not confined to bed. And also attach appropriate flow meter to oxygen source and attaches oxygen tubing. Adjust oxygen flow rate to prescribed dosage. A humidifier is used, verifies that water is bubbling. Observe for proper fit, function, and FiO2 of delivery device. If simple mask, places securely over the client's nose and mouth. And then ask the client if she is okay with the position of the face mask. Obtains an order for ABG or pulse oximeter 10 to 15 minutes after initiating of therapy or change in oxygen concentration. Consults with physician regarding the need for continuous pulse oximeter if client's oxygen level is not stable. Then after doing the procedure, perform hand washing for at least 10 to 15 seconds. After hand washing, check the client to evaluate responses both at rest and with activity. Bali po mo dyan, ma'am. Ano pong namatin niya?
Okay na ang paghangos ko.
Sige. After client verbalizes indication for supplementary oxygen, monitor for unexpected outcomes and perform related intervention. After that, record and report intervention in patient responses. First is to verify the physician's order, and then after that, gather the equipments needed for the procedure. And after that, perform hand hygiene for at least 10 to 15 seconds. After that, identify the client using two identifiers. Pwede ko po ihapot, ma'am, kung anong pangalan niyo po, edad, with a birthday.
Okay, ako si Ana Corazon. 20, November 30, 2000.
And explain the user of the nebulizer and describe possible drug side effect. Po, mama, nebulizer po kita para maibsan po yung yung paghangos niyo. And ang possible side effect po kay ni ma'am is pwede po mag-dry yung mouth niyo. Assemble the nebulizer per manufacturer direction, add the prescribed medication and diluent if needed to the nebulizer. And let the client hold the mouthpiece between the lips with gentle pressure. A face mask is used for a child, an infant, or an adult who is fatigued, who cannot follow instruction, or who is unable to follow instruction. Use special adapters for client with tracheostomy. Also ask the client to take deep breaths slowly to a volume slightly. And also teach the client the breathing pattern. After turning on the small volume nebulizer machine and ensure that a sufficient mist is formed, tap the nebulizer cup occasionally during treatment and toward the end of the treatment. When the medication is complete, nebulizer and liquid is gone, turn off the machine and store tubing assembly per agency policy. Encourage client to rinse mouth and gargle with warm water after nebulization. Then after performing the procedure, perform hand washing for at least 10 to 15 seconds. Then after that, monitor for unexpected outcomes and perform related intervention. Record and report intervention and patient response.